Welcome back to my channel. And if you are visiting this space for the first time, you are also highly welcome. In this lecture, we'll be looking at the differences between the urogenital triangle and the anal triangle. I've put up a lecture on the urogenital triangle and also the anal triangle. If you've not checked that lecture out, please kindly go and do so. But for the purpose of this class, we would be comparing these two triangles. This is the configuration of the pelvic cavity, and we know that the pelvic cavity is guided inferiorly by the pelvic floor or the pelvic diaphragm. And this is what is highlighted here in purple. Inferior to the pelvic floor, the pelvic diaphragm is where we have the perineum, and this is what is carved out here in this region. The perineum is a diamond-shaped configuration, and this is why it is divided into two triangles. So at this alignment created here in dotted blue, we have the perineum further subdivided into an anteriorly placed triangle and also a posteriorly placed triangle. The anteriorly placed triangle is referred to as the urogenital triangle, while the posteriorly placed triangle is referred to as the anal triangle. So let's go through with this lecture to unfold the differences between these two triangles. So let's look at the differences between the urogenital triangle and also the anal triangle in terms of how they are configured. If we try to use this image here, we say that we have the pelvic cavity around this region that is guided inferiorly by the pelvic floor or the pelvic diaphragm. This is what we say is highlighted here in purple. While inferior to the pelvic floor, the pelvic diaphragm is where we have the perineum, which is further subdivided into an anterior triangle that is highlighted here in red, and also a posterior triangle that is highlighted here in yellow. This subdivision is created by this imaginary line that is highlighted here in dotted blue. This imaginary line is seen to run from one ischial tuberosity to another. And at the midline region, you see it crossing through the perineal body. We've tried to establish this in our previous lecture on the urogenital triangle and also on the anal triangle. So you say that the urogenital triangle is a triangle that is, of course, a subdivision of the perineum that is located in the anterior region. So it is anteriorly placed, while the anal triangle is located at the posterior region. And because we say that it is a triangular configuration, it will definitely be having an apex and also a base. For the urogenital triangle that is located at the front, we see that the apex, as arrowed here in purple, is directed towards the anterior region, while the apex of the anal triangle that is arrowed here in purple is seen to be directed towards the posterior region. So you see that the apex of these triangles are directed towards different poles, considering their configurations. So if you also go further, you see that the base of the urogenital triangle is what is arrowed here at this point, and you see that it is directed towards the posterior region, while the base of the anal triangle is what is also seen to be arrowed here in yellow, and you see that the base of the anal triangle is directed towards the anterior region. So it's good for us to be able to describe how these triangles are positioned within the perineum. Also, to add, the urogenital triangle is located anterior to the perineal body. Remember when we tried to establish the demarcation through which these triangles are formed, we say that it is an imaginary line that runs from one ischial tuberosity to the other. And you see that along this course towards the midline region, they are seen to cross through the perineal body. This is the perineal body here, highlighted in black. So you can say also, in terms of how they are positioned, we say that the urogenital triangle is located anterior to the perineal body, while the anal triangle is located posterior to the perineal body, because the perineal body here is standing as an intercept between these two triangles. While one is located anterior to it, the other one is located posterior to it. And the one that is located anterior to it would definitely be the urogenital triangle because it is anteriorly positioned, while the one that is located posterior to it would be the anal triangle that is, of course, posteriorly placed. So it's good for us to be able to describe how this pattern or the alignment of these triangular configurations are positioned and are also directed. So also going further on the differences between the urogenital triangle and also the anal triangle. If you look at the urogenital triangle at the front, you see that within it, we have the urethra, and this is what is highlighted here in blue. So the opening of the urethra is seen within the urogenital triangle that is anteriorly placed. In addition to this, in female, we have the opening of the vaginal canal, and this is what is highlighted here in pink, and this is located behind the opening of the urethra. So we see that these two structures, which include the urethra and also the vaginal canal, are structural components of the urinary system and also the genital system. And this is where the name urogenital triangle is being drafted from, because it means that it is a triangle that allows the opening of organs from the urinary system and also the opening of organs from the genital system. So you see that this name urogenital is from the structures that are opened within this region. Also, the posteriorly placed anal triangle, we have the opening of the anal canal, and this is what is highlighted here in black. We know that the anal canal is the terminal region of the gastrointestinal tract, and this is also where the name anal triangle is being drafted from, because this anal triangle is seen to allow for the opening of the anal canal. So you can see how the name, of course, is being drafted based on the structures that are seen to open into this space. Well, in addition to the anal canal within the anal triangle, we also have the external anal sphincter. And this is the external anal sphincter here highlighted at this point. The external anal sphincter is a voluntary sphincter and is seen to surround the opening of the anal canal at this region. So you also have this specific structure also located within the anal triangle. Also going further within the anteriorly placed urogenital triangle, this anteriorly placed urogenital triangle is a complex triangle. It is more complex than the anal triangle that is located behind it. And the reason behind this complexity is because within the urogenital triangle, we have two pouches. So it is within the urogenital triangle that is located in this anterior region that we have the deep and also the superficial perineal pouches. These pouches are limited to just the urogenital triangle. They are not seen within the anal triangle. And also to add that within the anal triangle, we have the ischioanal fossa. The ischioanal fossa is also specific to the anal triangle. So on both sides of the anal canal, where we have this opening that is highlighted here in black, and also its surrounding external anal sphincter, we have two fossae located on both sides of this opening within the anal triangle. And this is what is seen to be highlighted here in red. So you have this fossa referred to as the ischioanal fossa. This ischioanal fossa, we say there are two. We have one on this side and we have another one on the other side. This fossa is seen to be embedded with fatty fibrous tissue, and this helps to hold or position the rectum and also the anal canal in place. It also helps in the process of defecation. During the process of defecation, there is contraction and also relaxation of the wall of the anal canal, and this fossa, because it is filled with fatty tissue, is seen to help control this process and also prevent the anal canal from prolapse and also from damage. So you see that in the specific triangles, we have specific structures located within it. And of course, they are responsible for exhibiting specific functions as we have highlighted. So you can add to these differences, and I'll be expecting your responses in the comment section. So thanks for watching this video. Let's continue to stay glued to this channel.